Did you know that donating plasma is one way that you could save a life today? Plasma is such an important part of our blood because it contains so many things that helps our body function properly. In this diagram right here, we have a little picture of the components of blood, where 45% is red blood cells, less than 1% is white blood cells and platelets, and the rest, 55%, is plasma. Plasma contains certain types of proteins, clotting factors, and things that fight off disease that help our bodies function properly. But there are some people in the world today that don't have these things, that aren't able to allow their bodies to function properly. And that is why donating plasma is so important. And today we're going to discuss briefly the donating process, what exactly is used from plasma proteins, and who is affected by the medications that come from donating plasma. So first, the donation process. It's super easy, super simple. The first time you go in and you're going to go through a physical just to make sure that everything is okay with your body and make sure that you are healthy enough to donate. After you go through your physical, you'll be screened for certain things such as your blood pressure, your pulse, temperature, weight, and protein to make sure, again, that you're healthy enough. And that happens each time you go and donate. After you complete the screening process, you will go to the floor where a phlebotomist will hook you up to a machine that separates your red blood cells from the plasma, looking somewhat like this. This process takes about 45 minutes or so, and one donation really makes the biggest difference in our life, because that plasma contains so many things that will help people with certain diseases. The parts of plasma that are used first is clotting factors. It is very important that when we're cut that our bodies are able to heal it pretty quickly so that we don't bleed out, so that we stay healthy. There are immunoglobulin, that helps fight infections and strengthen your immune system, so when you get a cold, when you get strep or the flu, anything like that, your body is able to fight against that. But some people don't have that, and so it becomes very life-threatening in their situation. Albumin is used to treat burns, trauma patients, and surgical patients. And finally, hyperimmunoglobulin treats rabies, tetanus, dialysis patients, organ transplant patients, and pregnant women who have the Rh incompatibility with their child, and so they're able to take this medication or get a shot that makes it so their bodies won't attack their child because of the different blood type. And so all of these things are super important, as you can see, in your own body function, and many of us have that, but some people don't. And those are the people that really benefit from plasma donations. And now we'll discuss some of those diseases that are more common than we may realize. The first one is alpha-1 deficiency. And this is one of the most common hereditary diseases, and that it can lead to life-threatening liver disease and lung disease in adults and children. The second is hemophilia, which affects 1 in 10,000 people. It is most common among men, and women are usually the carriers, and this is when they have a lack of clotting factors. There's the primary immunodeficiency disease, which is when the immune system doesn't work properly and isn't able to fight off the common cold, the flu, anything that would be so simple to us, and it can become life-threatening. And finally, plasma proteins are used to treat burns, major surgery patients, shock, organ transplants, immune diseases, animal bites, and trauma. There are so many things that the plasma donation help people with. I don't think any of us realize how far one donation can go. Many don't know how many donations it takes to treat one patient for these diseases. For example, it takes more than 1,200 donations to treat one patient for hemophilia in a year. It takes more than 900 donations to treat one patient with alpha-1 deficiency in a year. And finally, it takes more than 130 donations to treat one patient with primary immune deficiency in a year. So as you can see, there's a lot of plasma donation that needs to happen from us that are allowed to help these people so that they can live a normal life, so that they're not affected by their disease. One donation can make the biggest difference in one person's life.